If you are or have ever lived with a diabetes patient, you have probably had several conversations where people have given you advice on how to deal with the condition. Advice like you won't have to go to the doctor if you have soaked methi seeds or drink the juice of bitter gourds in the morning. Have you ever wondered why so many people claim to be experts on diabetes despite having no medical training of any kind? It is because this problem is too common and doesn't scare us anymore. Hi there, you're listening to Unviral, the podcast where we tackle that dangerous combination of the two kinds of virality. Misinformation about health. I'm Parvati Mohan, production lead at Factly, and in this episode we talk about diabetes. Diabetes is very common. We all probably know at least 5 people living with this condition. Anecdotally, we know that there are many people living with diabetes in India. But what does the data tell us about how widespread the problem is and what the problem is really? Joining me now to answer these questions is Nandita Kalidas, the former Factly Meta Health Fellow. So what does the data say, Nandita?
Like you rightly said, anecdotally, we all know people with diabetes around us. The same, when translated into real data, 1 in 6 people with diabetes in the world is from India. Now, according to the International Diabetes Federation, IDF estimates, there are about 77 million adults in India who were living with diabetes in 2019. And this rose from 41 million just in a decade. Now, let's first understand what diabetes essentially is and what are its implications. To break it down into simple terms, diabetes is a chronic disease which occurs when the pancreas does not produce enough insulin or when the body cannot effectively use this insulin that it produces. Now, without this insulin, the sugar or the glucose in the body does not enter the cells to produce energy. This leads to an increased concentration of glucose in the blood. So you either have under or over glucose in the bloodstream that needs to be regulated. Scientifically, it can be categorized into 3 types: type 1, type 2, and gestational diabetes. Now, type 1 diabetes is characterized by pancreas producing little or no insulin at all, also known as juvenile diabetes. And the lack of this insulin production actively requires people to be insulin dependent, and this is where we hear insulin shots and among other things. On the other hand, type 2 diabetes is caused by the body's ineffective use of insulin. So here the cells in the muscle, fat and the liver become more resistant to the insulin. Because these cells don't interact in, say, the normal way with the insulin, they do not take in enough sugar. It often results from excess body weight and physical inactivity, and this is the more common type found in our population as well. So the thing about the type 2 is that it often develops slowly, and you can be living with type 2 diabetes for years and still not know about it. As the name suggests, gestational diabetes is diabetes diagnosed for the first time during pregnancy and can cause high blood sugar that can actually affect the pregnancy and the baby's health. Obesity and overweight are primarily the more important risk factors responsible for diabetes. Much of the diabetes burden in India can be prevented or delayed by behavioral changes to lifestyle favoring a healthy diet and a regular physical activity.
The fact that diabetes is as widespread as it is means that all these patients and their loved ones assume that they know everything there is to know about it. This overconfidence leads to a situation where people no longer want to learn anything new about diabetes or are not open to their knowledge or beliefs about it being questioned or corrected. A direct result of this is that a lot of myths about diabetes are being passed around as true information that many people take for granted. The myths about diabetes seem quite layered. On the one hand are the myths around seemingly benign topics like diet and drugs, while on the other are the scary ones like you will have to amputate parts of your body if you don't manage diabetes properly. Nandita, can you take us through some of these scary myths and what the reality about them is?
Like any other health misinformation, the diabetes myths are layered as well. From the cause of diabetes to the consequences of it, the cycle is strewn with varied range of myths. So like you mentioned, these myths range from diabetes being caused by eating too much sweet food, or only obese people are prone to diabetes, or serious implications like diabetes would eventually cause loss of sight or blindness, or serious body amputations like you had mentioned. While these are plausible outcomes of diabetes, it is only in extreme and rare cases that these things happen. While poorly controlled diabetes is a risk factor of a loss of sight, not everyone with diabetes is or will be blind. In case of amputations, again, it is a consequence of very, very poorly controlled diabetes, which leads to, say, the blood vessel damage in the long run, which in turn leads to complications like nerve damage, foot issues, kidney and liver failure, and strokes in the very serious or worse cases. So, given the gravity of this chronic issue, it must be noted that not everyone will have to face the fatal consequences of the diabetes if it is properly managed. A healthy diet and an active lifestyle will suffice to manage this chronic condition, to be clear. When I say a healthy diet, it means different things to different people. And this is where the diabetic lifestyle is extremely riddled with number of myths that you had earlier mentioned. This includes completely avoiding or eliminating fats and carbohydrates from the diet, or too much or too little exercises, following WhatsApp based quote unquote home remedies, and even experimenting with distasteful concoctions every morning as a cure for diabetes. So one must be wary of what they're consuming and preferably follow a regime that is prescribed by doctors, medical professionals, or nutritionists, or whoever they actually consult with.
I spoke about the comparatively less scary myths a little earlier, and Nandita has also spoken about some of these which are related to the kind of diet a diabetic person should consume. Some people will tell you that eating herbal foods is good for you, while others may say that we should switch to expensive varieties of brown rice to regulate the condition. At Unviral, we like to take such questions to medical practitioners instead of guessing at which one is right. And so, we now have Dr. Prabhakaran Dorairaj with us to tell us what a diabetic person should actually be consuming. Dr. Prabhakaran is the Vice President of Research and Policy and Director at the Center for Control of Chronic Conditions, Public Health Foundation of India.
Essentially, healthy food does not involve consuming an exotic fruit. You don't have to consume an apple, you don't have to consume a kiwi or avocado or something like that. All you require is the locally available fruits. There are many places where you get amla, for example. You get local berries, for example, Goa, which are cheaper during the season. So there are many fruits which are seasonal, which are cheap, orange in many parts of the world. So you consume whatever fruits that are seasonally available, that are cheap or inexpensive, and that is part of your culture. You don't have to change. An apple a day may keep a doctor away in the UK. It need not necessarily keep away a doctor in India. So an amla a day may keep a doctor away in India. So you need to change that thinking. Second is vegetables are available. I mean, locally produced vegetables are available aplenty, and they are inexpensive at times. I mean, during winter seasons, many of the vegetables are available within 10-15 rupees a kg, and they are good. So you don't have to look at a red capsicum or a red chili or a yellow capsicum, zucchini or avocado or anything like that. Your locally available fruits and vegetables are adequate.
While we are still on the topic of food, it is important to talk about the issue of how much to eat in addition to what we should eat. Some people believe that diabetics should give up everything that tastes good and turn strictly to health food, while others think that diabetes is not that serious a condition and that it can be managed with medication alone with no major modifications to diet. Let us hear what Dr. Prabhakaran has to say about this.
I would emphasize the importance of moderation. You don't have to become a martyr once you develop diabetes, giving up sweets, giving up sugar, giving up doing extremes of exercise. You don't have to do all those kind of things, because the motto should be moderation and not martyrdom. So that should be the motto which we should convey. Moderate changes in activity, half an hour to 45 minutes of brisk walking every day, or at least 5 days a week, and moderation in your diet. I mean, let us say that you are fond of ice cream, you want to eat ice cream once a week. Please go ahead and eat it, but you can exercise it away. After eating the ice cream, just go for a walk. If you are eating something in excess, reduce something else. Like, for example, you eat 3 chapatis a day, and that day you wanted to eat a sweet or ice cream, reduce it to 2 chapatis. So you can just, in a very smart way, modify your diet and still enjoy whatever you enjoyed. So diabetes is not the end of the road in terms of eating the things that you like, but you have to eat in a smart way and keep everything in moderation.
Moderation in diet, consumption of local healthy foods, and a decent amount of exercise can help a person regulate their diabetes. So says the doctor. But not all doctors advise the same treatment for diabetes. A few go to the extreme of claiming that their program can completely cure a person of diabetes and not just manage it. You came across such people and their claims in your research on diabetes, Nandita. Take our listeners through what you found.
So, in the context of diabetes, misinformation often appears in captivating messaging that diabetes will be cured in 2 days, often giving people hope that their chronic condition might finally have a cure. So, the spectrum of this misinformation ranges from the prescription of insulin in India as a scam to help pharmaceutical companies to make profits, to fad diets, to 2 day homeopathy cures for diabetes, and eating a dozen bananas to actually cure these diabetes. A lot of such fake news has been circulating on social media platforms for years now. While information dissemination continues on social media, one doctor who has owned the misinformation space on diets and COVID 19 is Dr. Bishwarup Roy Chowdhury. He's a self proclaimed doctor who claims to hold an honorary PhD in diabetes studies from Alliance International University, Zambia. Now, this Zambia is headquartered in Caribbean and not in Africa. So, before spreading misinformation on the COVID 19 pandemic, his forte was to curate this special DIP, that is the disciplined and intelligent people diet that he likes to call it, to reverse diabetes within 72 hours. His antidote to curing diabetes is to eat quote unquote sweet fruits so blood sugar actually comes down. He has hosted several online and offline events, and people have flocked to watch his magic, scientific cures. His YouTube videos have over 1 million views. The psychophancy can be seen in the comments on his videos where people heap praise on him for his misleading messages. The engineer turned doctor's DIP, the intelligent diet, promises to cure diabetes, thyroid, PCOS, and even cancer, among many other chronic problems.
That is a very important point that you raised, that we need to be very careful and very mindful about what we consume and from where. So let us go back to Dr. Prabhakaran on this. Is it possible to cure or reverse diabetes in any form? This is what he had to say.
So diabetes can be controlled. You can reverse diabetes for some years, but you cannot cure. Once you develop diabetes, you cannot cure it. Like for example, let us say that I am diagnosed diabetes today. My hemoglobin A1C is 7.5, and my fasting blood glucose is 140 or so. I can reverse it and bring it back to normal by following some lifestyle advices. I mean, if I'm in the very early stages, or if I take a simple drug, it can come down. But I cannot be completely cured of diabetes, because if I don't follow those practices, it will come back again. So I need to follow the lifestyle practices which help me in controlling my diabetes. I need to take the drugs, simple drugs, albeit, which will help in controlling diabetes for lifelong. So there is no real cure for diabetes. I mean, unless you do a pancreatic transplant, which is not being done, which is very expensive to do, and maybe in the future we might get islet cell transplants, which might help. But those are all futuristic, and so there is no. To answer your question in brief, there is no real cure for diabetes. You can control, you can postpone. You more importantly, you can postpone the complications of diabetes. You don't have to get kidney disease, which is a problem with diabetes. You don't have to get heart disease, which is if you control your blood pressure and lipids, which is part of the diabetes management. You don't have to get stroke. You don't have to get gangrene of the foot. So all of those things can be prevented or avoided. Focusing just on the cure of diabetes actually takes away from what can be done in a very simple way, that is control your blood sugar, control your hemoglobin A1C, and follow those simple practices that help you in preventing all those dreaded complications that can occur 10 years down the line.
Many people steadfastly believe that if one of their parents is diabetic, they are bound to become diabetic too. We asked Dr. Prabhakaran about this, and this is what he said.
Not necessarily. I mean, it when you say hereditary or genetic factors contributing, it actually leads to a fatalistic tendency. So you kind of think that you're destined to get, and so you say whatever I do, I will get. That's not really true. There is a saying that you can trump destiny with intelligence. So essentially, the intelligence here is in terms of following the right kind of practices. So let's say you have a very strong family history of diabetes. that it is possible that you might get diabetes by 45 years, 50 years or so. By your proper lifestyle, healthy lifestyle, you can postpone it by another 10 years. The more the number of years that you postpone, the better is in terms of your long, healthy life. And therefore, while it may be true that you have a higher risk of getting diabetes if there's a strong family history, you can always postpone the time at which it occurs. And postponing the number of years by which diabetes occurs means you will have a long, healthy life. And that's a message that should go out.
We have been talking about the various ways of managing diabetes through diet and exercise. But we do know that a lot of people living with diabetes take medicines as a part of their regimen. As with everything else, different people have different opinions on this issue too. Some believe that Western medicine is the only way out, while others strongly advocate the usage of traditional and alternative medicines. Let us hear from Dr. Prabhakaran on his take on alternative medicine.
See, some of the traditional forms have been evaluated. Take yoga, for example. Yoga is a good preventive tool. It's common sense that yoga is very useful for prevention. So, if you are a normal person, you do yoga, you can delay progression to diabetes. I mean, this also has been shown by the conventional scientific way of if you reduce your body weight by around 5% or so, you prevent the if you are a pre-diabetic, you prevent the progression to diabetes. So clearly there are some traditional methods which are extremely useful, and yoga is really one of them. In terms of the traditional drugs, herbal drugs that are available, some of them have been evaluated, some of them have not been evaluated. So one needs to look at those that have been evaluated. A large majority of them have not been evaluated in clinical trials, so one needs to be very careful about promoting them.
Dr. Prabhakaran has raised an important point about why we need to adhere to treatment methods that have been evaluated. But the fact remains that many of us are not sure where to access the right information related to health concerns. You have worked on health information and misinformation for over a year now, Nandita. As someone without a background in medicine, how would you say people should find the right information about health?
Whether you have been newly diagnosed or have been fighting against type 1 or type 2 diabetes for a while, or you're just helping a loved one with the problem, it is first and foremost important to understand and accept that the problem at hand. There is no shame in having it, and there is no reason to believe that this is a curse or any other stigma associated with it. Celebrities ranging from Tom Hanks, Salma Hayek, Nick Jonas, Sonam Kapoor have all been vocal about living and dealing with diabetes. As Dr. Prabhakaran rightly said, moderation is the key, and especially in a chronic condition like diabetes. One must be careful about misinformation around nutrition, which is an under-debated topic. In fact, we dealt with this in detail in episode 2 with Dr. Subbarao, scientist at NIN, and we'll link that episode in the resources and you can listen to the same. So, therefore, we advise you to be more vigilant when it comes to food labeling. Always be on a lookout for added sugars, saturated fats, hydrogenated or partially hydrogenated oils, among other things. Given that diabetes is common, one should not negate its severity on either extremes. Since there is no magic cure, the only scientific and proven resolution is to have an overall lifestyle change, including diet control, physical activity, that can prevent, control, and manage severe diabetes. Plausibly reverse pre-diabetes or extremely mild diabetes as well. And when I say diet control, we mean to advise to follow a sustainable long-term plan that is vetted by a relevant nutritionist or a doctor, and this primarily requires commitment and discipline more than trying out quote unquote expensive alternate therapies, eating exotic fruits and vegetables, among other things. While Google seems to be an obvious place to start to look for answers, please do note that Google is not a know-all end-all place, especially for health or chronic conditions. It is important to see your doctor, who will evaluate your real-time condition and suggest the necessary way forward based on your risk factors. While one can explore alternate treatments definitely, one should be careful to distinguish between credible alternate treatments and the quacks whose advice can in fact make these health issues worse.
It also makes sense for us to understand the medical perspective of this issue of where we get our information from. Dr. Prabhakaran shares his thoughts on the information overload and a few suggestions on where to get health-related information from.
The right information on diabetes, there are multiple sources nowadays. You have multiple sources in terms of getting the right information of diabetes. So in India, for example, you have the RSS, RSSDI, the Endocrinology Association of India. There are several medical associations, the Indian Medical Association, the Association of Physicians of India. So on their websites, you will have some information on diabetes. The American Diabetes Association has got a patient portal, which is extremely good. The government of India also has, and the state governments have their own portals in terms of advice with regard to diabetes. So I think like this podcast, for example, if we expand and specifically give advice to patients, maybe have an interview format with patients who have had diabetes and experts, because there are many questions that they do ask and they're unaddressed. So we could look at those kind of things. Google, it's a good source, but if you use it appropriately, because there's a lot of misinformation also. There are a lot of information which says that, eating this fruit or eating some fancy new drug will reduce diabetes. So you shouldn't go about looking at that. You should look at the credibility of the people who are giving that information. Are they medical professionals who are giving? Are they people in the field who are leaders in the area of diabetes? Is it coming from a credible association? These are the kind of things that you would look at. So I can't pinpoint one particular source where they can go and look at it, but they need to fact check as to who is giving that information before considering that information in their day-to-day practice.
Let us now move away from myths and misinformation and focus on what needs to be done by a person who suspects they may have diabetes. Dr. Prabhakaran shares a few important pointers.
Medical help should be sought. I think everybody should get what is called as an opportunistic screening. If they have a reason to visit a hospital, they should get their blood sugar checked when they visit the hospital. And if it is normal, they don't have to do anything for the next 5 years or so, maintain their healthy lifestyle and so on. If they have diabetes or if they have pre-diabetes, then they should consult a doctor who would advise them, and they should follow that advice. And if they are frank diabetes, so they should follow the advice till they are controlled, and meet the doctor maybe once in 6 months or a year.
India is often referred to as the diabetes capital of the world. Though China has technically surpassed us in this arena, the fact that there are about 77 million living with diabetes in our country is a cause of concern. This number will likely continue to go up if we, one, do not acknowledge that we have a diabetes epidemic in the country, and two, do not come up with a proper strategy involving multiple stakeholders to create the right awareness about this problem. Dr. Prabhakaran takes us through what he thinks this strategy should look like.
So I think the first thing is the media has got a major responsibility in reducing the misinformation, and that they should identify the misinformation, fake messages that go around and filter them out. And the way they do it, I don't know. There must be softwares, and there must be the. I mean, the technology has improved so much that they can identify these and automatically filter them out. That's number one. That is in terms of the negative part of the problem. In terms of the positive part of the problem, they should promote getting experts to be interviewed, podcasts like this, or TV shows. The Sansad TV or the Rajya Sabha TV has got a program on health, which is very good. I find that extremely useful. There's lots of information that comes out there. So people should be directed to those kind of information, which gives you advice with regard to what simple things that can be done in terms of both preventing and managing diabetes. The other thing that we have to understand is the control of diabetes cannot be left to doctors alone, but it is a bigger problem. It's a societal problem. It requires a multi-pronged societal approach in terms of promoting a healthy lifestyle in the population. So that includes tobacco control, alcohol control, tax rebates for fruits and vegetables, improving the shelf life of fruits and vegetables, reducing transport losses, incentives for agriculture in terms of growing healthy foods. So it is much beyond the medical profession. The medical profession obviously has to manage people with diabetes, has to prevent diabetes, has to provide advice to people. But there is a role for the government, the media, and the thought leaders, the political leaders, the religious leaders. So everybody's got a role in terms of combating this problem.
Let us also get a non medical perspective on this. As a person on the research and communication side of the problem, Nandita, what would you want to add to Dr. Prabhakaran's idea of the right strategy to approach diabetes awareness and management?
Well, adding on to Dr. Prabhakaran's pertinent scientific pointers, the governments must absolutely take note of some of the successful case studies, such as the CDC's National Diabetes Prevention Program, the DPP, which aims to change the way people approach type 2 diabetes through modified lifestyles. And this happens through, when I say modified lifestyles and self management methods, again, I'm going back to say healthy diets and active lifestyles. In fact, Kerala did adopt this evidence based lifestyle interventions implemented in the high income countries like US, Finland, and Australia. This program was in fact contextualized to the needs of the state, which aimed at cultural adaptation of a peer led lifestyle to prevent diabetes. That means people in groups were eating healthy, they had group physical activities where they were all actively participating in it as communities. And this had actually become like a cultural context in the state of Kerala. This meant that they leveraged the communities to create group based and peer groups to spread awareness, prevent and manage diabetes within these communities. They promoted healthy practices, active lifestyle, and monitoring within these communities. Kerala DPP, the Diabetes Prevention Program, is the first well evaluated community based peer led diabetes prevention program in India. Now, other state governments must look at scaling up of such an initiative to prevent and manage the diabetes epidemic in India. Now, added to this is the complex problem of misinformation that requires deep behavioral and psychological understanding of people. Digital literacy must involve modules to specifically address the negative impact of misinformation on diabetes, and governments must also create and target national, state, and community level campaigns on this evident problem to promote awareness and also to guide the population to prevent and manage chronic condition in India.
Managing diabetes or preventing it are not big problems. The solutions are as basic as maintaining moderation in diet and exercise, visiting the right medical professional when something is wrong, and taking the right medication. But the flip side to the basic nature of these solutions is that too many people now think that they are experts at handling diabetes and therefore do not need any help. We all know how science works. There is always new information coming in, which means that we need to be willing to unlearn the things that do not serve us anymore. While the overarching principles of moderation and seeking medical help at the right time stay the same, the nitty-gritties are dynamic and will, therefore, constantly need to be updated. This is true of all health issues. Over the course of this podcast, we have spoken about immunization, nutrition, menstrual health, maternal health, sexual and reproductive health, cancer, COVID-19, mental health, tobacco usage, and diabetes. While each of these issues comes with several specific challenges, there are a few common lessons that we picked up. 1. Information related to health is dynamic, and we need to be willing to learn new things and unlearn what we assume to be true. 2. There is widespread misinformation related to health, and so we need to know what sources to trust and how to consume health information. 3. When it comes to health, it is always better to seek valid medical opinions rather than guess at the issue or self-diagnose from Google. We have explored these issues and learnings in detail by analyzing available data and speaking to experts from many fields in the Health Misinformation Report that was released in November 2021. We have left the link to it in the description for you to engage with these issues in more detail. We have also left the links to other important resource materials related to diabetes. The problem of health misinformation is complex and will need to be tackled from various angles and by a variety of stakeholders. This podcast and report are meant as starting points in the conversation on health misinformation. We hope that our listeners and readers will carry the conversation forward with the insights gained from our work. To that effect, do share this podcast and the Health Misinformation Report with your loved ones. As we always say, take care, stay safe, and remember to unviral. Unviral by Factly is researched by Nandita Kalidas, written, hosted and produced by Parvati Mohan, and edited and designed by Jyoti Jiro. Thank you for listening.